Today we're talking a little bit about blepharoplasty surgery, specifically lower eyelid blepharoplasty surgery, in some of the considerations by looking at an example of a patient of mine. So this patient has a few different things going on. One is she has laxity of the lower eyelid. So as time goes on, the lower eyelid is pulling down a little bit because it's lost its elasticity. She also has extra skin of the lower eyelids, and she has a bit of bulging of the fat pads of the lower eyelids, primarily over here. The other thing to note that's important in her is she's lost fat in this triangular area of the face, which has caused an indentation just below where the fat is bulging out, and that indentation follows something called the orbital malar ligament. So all that being said, what do we need to do in order to restore the lower eyelid? So one thing we did is we performed a lateral canthopexy, which means that we took the lower eyelid tendon and we tightened it to a more youthful position, which is also functionally good because the patient won't suffer from dry eyes or loose lower eyelids later on. We also removed extra skin with an external approach blepharoplasty and removed extra fat from the lower eyelid pockets. We released the orbital malar indentation from inside and then resuspended that lower fat pad up in a mid-face type of lift. And then we borrowed some fat from the abdomen and fat grafted it into the cheek area to create a smoother contour. So if you look at her after picture with me here, you can see those changes. The bulging fat pads are gone, the lower eyelid is not drooping down in the same way it was before, and this malar cheek region is much smoother and cleaner, so the entire lower eyelid looks more refreshed.